Good day, I am Lassie Manahan from BSN 1-6. I am going to perform a return demonstration in assessing the thorax and lungs. Our goal is the assessment is completed without the patient experiencing discomfort or any anxiety. The findings are documented. Appropriate referral is made to healthcare professionals as needed for further evaluation. Preparation, assemble the following: stethoscope, centimeter ruler, and skin marker or pencil. The procedure is, first introduce yourself to the client. What are you going to do? Why it is necessary? And it's also important to identify your client. So good day, ma'am. I am Leslie Manahan from a student nursing from Wesleyan University. I am going to assess your thorax and lungs. What is your name po?
Angel Manahan.
Okay, ma'am, you are my patient. So, perform a hand hygiene. And provide the client privacy. Inquire if the patient has history in the following. Ma'am, do you have family history of illness? Cancer po? Wala po. May allergy po ba kayo?
Wala.
Wala po. Tuberculosis, ma'am?
Wala rin po.
How about, what are your lifestyle habit po?
Nagbabite every afternoon.
Every afternoon. Ma'am, do you experience swelling or cough? May ubo po ba? Wala po. And then, we will proceed to the assessment of posterior thorax. First is, inspect the shape and symmetry of the thorax from posterior and lateral views. Okay, ma'am, I will ask you to stand up. I will inspect you po. I may hold your body parts. Is it okay?
Yes.
Okay, okay, ma'am, turn around. Okay, ma'am, you may sit po. The findings are the thorax is symmetry. Next is inspect the spinal alignment for deformities. Okay, ma'am, stand up po ulit. Okay, talikod po. Yuko po, ma'am. Mag-bend po. Sige, ma'am. Okay na po, ma'am. Sige po, ma'am. Opo. The spine of the client is aligned. Next is, we will palpate the posterior thorax. Ma'am, stand up po. Turn around. I will inspect you, ma'am, ha? Okay. The findings are that the patient is uniform temperature and no tenderness or bulges. And then we will palpate the posterior chest for respiratory exclusion. Ma'am, take a deep breath po. Okay, inhale, exhale. Okay po, ma'am. Okay, ma'am. Palpate the chest for the vocal tactile firmitus. I'm using both of my hands in the corresponding areas for each side. Okay, ma'am, what I want you to do is said the word blue moon simultaneously while I am palpating you. Okay, turn around po, ma'am. Okay, begin po.
Blue moon. Blue moon. Blue moon. Blue moon.
Okay, ma'am. And then next is percast the thorax and percast the diaphragmatic exclusion. Okay, ma'am. turn around po ulit. I will ask you to have take a deep breath, and I will ask you to take a deep breath, inhale, exhale, and then hold. Okay, ma'am? And then what I am going to do is to tap my fingers, and I will ask you to inhale and exhale and then hold. Okay po? Okay, inhale, exhale, hold. Okay, inhale. Okay, ma'am, wait. Okay, again, ma'am, inhale, exhale, hold. Okay po. Wait a minute, ma'am, I will measure it. Okay. Okay, ma'am. As I measured, which is 5 centimeter, which is the which is the require for diaphragmatic exclusion. And then next is we will osculate the chest using the flash disc of the flash disc diaphragm of the stethoscope. Okay, ma'am. We will using the systematic zigzag procedure with the use in percussion. We will use the zigzag procedure used in the percussion. Okay, ma'am. Harap po. Pwede po kayo maupo, ma'am. I want you to take a deep breath using your mouth po. Okay, ma'am. And then you exhale po. Inhale, exhale, mama. Okay po. Inspect the breathing pattern of the client. Okay, ma'am. Please inhale and exhale. Okay, the patient's breathing pattern is quiet and normal. And then next is inspect for the costal angle of the client, which is when ribs enter the spine. Okay, ma'am. The client has a less than 90 degrees angle. Next is palpate the anterior chest for the respiratory exclusion, and palpate the tactile fremitus in the same manner as for the posterior chest. Okay, ma'am. Take a deep breath po. Ma'am, I will hold this to palpate you. Is it okay? No po. Okay. And then, next is percuss the anterior chest systematically. Displace the female breast for proper examination. Sorry. Next is percuss the anterior chest systematically. Displace the female breast for proper examination. Okay, ma'am. Again, I will percuss you. I want you to take a deep breath and hold as I will tap my finger. I will place my finger and then tap it. Okay po? Inhale, exhale. And then, osculate the trachea. Lift your chin up. Next is auscultate the anterior chest. Use the sequence used in the percussion beginning over the bronchi between the sternum and clavicles. So, ma'am, hinga lang po ng malalim. And then exhale. And then, document the findings in the client's record. Thank you.